All right, everybody, so this is going to be our last video on alterations of cardiovascular function. So we had gone all the way up through coronary artery disease and then talked about heart attack. So now we're going to talk about pericarditis. Okay, the ITIS tells us we have inflammation. And the inflammation is of the pericardium. We remember the pericardium is a membranous sac around the heart. There are two layers. The visceral pericardium is attached to the heart itself, and then the parietal pericardium is attached to the space in the thoracic cavity that the heart occupies. So these two layers in between them, we have fluid, and that is designed so that when the heart contracts and relaxes, it's doing so in a friction-free environment. When someone has pericarditis, the inflammation is usually due to a viral infection. And what can happen is the membranes can become inflamed, so there'll be some swelling, and so they can become somewhat roughened and now rub up against each other, and that's going to cause, obviously, a lot of pain. And that pain would be retrosternal. So you will have some pain, fever. Obviously, with infection, your body's inflammatory response would include as a secondary measure of fever, so that's your body's normal response to infection. Obviously, you're going to have pain, more pronounced pain during deep breaths. Okay, the treatment for pericarditis is really to relieve these symptoms, right? So for example, for pain, you would take an analgesic. For fever, you could take an antipyretic. And then you could take an anti-inflammatory agent to try to reduce the inflammation, which is really getting to the pain that they're experiencing. Because it's a virus, you would not treat with an antibiotic because it's not bacterial in nature. Okay. The last couple things we want to talk about. First, we're going to talk about valve dysfunction. But because we are talking about valves, we want to do a quick review as to what the point of valves are in the heart and why they're there. Okay, so remember you have two sets of valves. You have the atrioventricular valves and the semilunar valves. The atrioventricular valves are going to be, if we're looking at the heart. Sorry, it's very noisy in my house during this video. The atrioventricular valves are going to be between where the atria meet the ventricles. So on the right-hand side heart, you would have the tricuspid. And on the left side, you'd have the bicuspid. The cuspid refers to how many cusps make up the valve. So it's 3 on the right and 2 on the left. Bicuspid is also sometimes called the mitral valve. And then you have valves between the ventricles and whatever artery that they're servicing. So on the right-hand side, you have a semilunar valve between the right ventricle and the pulmonary trunk. That's called the pulmonary semilunar valve. And then on the left side, you would have another valve between the left ventricle and the aorta. So that would be the aortic semilunar valve. And from the right ventricle to the pulmonary trunk is the pulmonary semilunar valve. What is the point of having these sets of valves? Is you want to have unidirectional flow of blood. Flow through the human circulatory system is a one-way street. So anytime you install valves, what you're trying to do is preserve that unidirectional flow and prevent backflow of blood into either a previous chamber, or in the case of venous valves, you want to keep blood from pooling in certain areas. So if someone has a dysfunction of a valve, what we would lose would be the unidirectional flow, and you would have regurgitation of blood into spaces where it's not supposed to be. There are several different types of valve dysfunctions, which would include something like stenosis, which if someone has stenosis, you would have a narrowing of the valve, and blood cannot flow forward, so it kind of gets stuck in the previous chamber or vessel. You can also have something like regurgitation. So for example, if, let's say, the tricuspid valve, if this valve is deteriorated, when the right ventricle pumps, blood is going to kind of spit back up into the right atrium, and then potentially, remember, blood coming onto the right side heart is coming from the venous system. So then you could have blood backing up into the venous system. On the left-hand side, let's say it was this valve that was deteriorated. And you can have deterioration of the valve simply with age, but if the left valve, the mitral valve, was deteriorated, then you could have valvular regurgitation into the left atrium. And then again, remember, blood coming in from the left side is coming from the lung, so you could have fluid backing up into the lung, obviously, and then have pulmonary edema. So one of the issues that can occur, that can cause that regurgitation, is something called mitral valve prolapse. And when someone has mitral valve prolapse, the cusps of the valve kind of billow upward, and so they're not closing completely. So again, then you'd have blood backing up into the left atrium and then potentially back into the lungs. Very often when someone has a dysfunction in one of their sets of heart valves, it's accompanied by a heart murmur, which is something that can be fairly easily assessed simply by listening to the heart sounds of the patient with a stethoscope. If there is an issue with a heart valve, the treatment for it is really a valve replacement. Okay, heart failure. Okay, so we remember now the structure of our heart, and that our heart is a double pump. But you can kind of think about it this way. Okay, so your heart has a right and a left pump. The two pumps work together. The right and left side of your heart is separated by the septum. The pumping mechanism, when we talk about the heart pumping, we're really talking about what's going on in the ventricles, not the atria. Okay, so remember, the atria are up top, ventricles down below, and then you have the valves here that are going to separate atria from ventricle and allowing one-way flow. Okay. The job of your ventricles when they pump is to eject blood either into the pulmonary system if you're talking about the right side heart, or into the systemic circulation if you're talking about the left side heart, right? So these ventricles need to pump with some definable force so that you can have some discernible measure of what's called cardiac output, especially the left ventricle into this systemic circulation. Remember, pressure coming out of the right side heart into the pulmonary system is, generally speaking, much lower than the pressure coming out when the left ventricle pumps into the aorta. So when someone has heart failure, what you're looking at overall, the big picture is you would have a drop-off in cardiac output. And why that is dangerous is then you would have inadequate perfusion of tissue. Meaning you're not getting sufficient oxygen to the tissues that need it to carry out aerobic cellular respiration. Okay, this condition affects approximately 10% of individuals over the age of 65, so it's fairly common. Okay, so some of the risk factors would include things like age, obesity, pre-existing conditions like diabetes, if someone has a valve issue, renal failure. So left side failure is more common than right side failure, but let's talk about what would happen when you have left versus right side failure. All right, so we're going to draw the heart one more time. So this is right, this is left. Here's our little valves. Okay. Remember, blood coming in on this side. So blood coming into the right side heart, so coming into the right ventricle, is coming from your venous circulation. So it's coming from your veins. So blood is going to empty from the venous system into the right atrium and then move into the right ventricle and then be pumped out to the lung. On the left-hand side, blood coming into the left atrium is coming from the lung. So we can imagine if the right side heart is failing, if it's not pumping with enough force, you are not going to eject blood out of the ventricle, but perhaps blood would then get stuck, right? And kind of back up like traffic. You have one car stopped, everybody behind it's going to stop too. So if you don't have sufficient, I'll use the word force, coming out of the right ventricle, everything behind it is going to back up. So because of that, if someone has failure on the right side, you would get swelling. So you would have swelling in the lower extremities to start, and then the upper extremities can occur as well. The weaker the heart gets, the more of the backup that you would have. On the left side heart, if the left ventricle is not pumping with enough force, blood is going to back up into the lung. And when blood backs up into the lung, you would have pulmonary edema. Which you can hear, it would sound like congestion in the lung. In addition, if someone has pulmonary edema, obviously they're going to be, and would be either way, if you have, your heart is failing, of course you're going to have fatigue. Feeling tired all the time, especially if you tried to exert yourself in any way. So someone who has pulmonary edema would experience things like shortness of breath, but also would cough up like a pink, frothy sputum, okay? So we've got two different sides of the heart with two different presentations for failure. If the whole heart is failing, then you would have both sets of symptoms. You would see both swelling in the extremities and you would see pulmonary edema as well. The treatment for heart failure is really, you're trying to manage the symptoms. So one way that we can manage these symptoms is we've got a fluid problem when you get down to it, is you could give a diuretic. Right? By giving a diuretic, what you're doing is encouraging the patient to diurese more frequently and thereby relieving some of that fluid pressure. Now, if there's a blockage to the coronary arteries, perhaps that's causing the heart to be deprived of oxygen and fail, you could do something like a coronary bypass graft. But what this patient really needs is a new heart. Okay, it's a heart transplant. Okay, that's going to do it for alterations in cardiovascular function. Our next unit is digestive system.